G'day pedals and welcome to this Stop HIV Active Aging discussion. My name is 𝗍𝗂𝗆𝗆, your host for today. I am a drag queen, if that wasn't already obvious, and an HIV activist here in London. And I am here joined by the incredible Dr. Laura Waters. Now, Dr. Laura Waters is the former Beaver Chair. She is a consultant at the Mortimer Market Centre. She is the chair of NHS England HIV-CRG board, and she helped launch the People's First Charter to help change HIV language. So if anyone is qualified to talk about this topic, it is Dr. Laura Waters and myself. And Laura, thank you so much for joining us today. How are you?
Yeah, I'm good, Daisy. Thank you so much. It's an honour to be here. And if I got an intro like that every day, I would be truly impossible to work with. Thank you.
Well, I am available for hire. So, Dr. Laura Waters, thank you so much for your time today to discuss this important topic. That topic being HIV and active aging, specifically for LGBTQ folks. Now, to kick it off, how important do you think screening and testing for HIV is in the UK?
Well, thank you, Daisy. And it's always good to start with a question on testing, because testing is that critical first step that's a gateway. And it's a gateway because if you test HIV negative, it's an opportunity to talk about how to prevent HIV and other sexually transmitted infections. It's a chance to talk about pre-exposure prophylaxis or PrEP, which is taking HIV medication to dramatically reduce your risk of getting HIV. But of course, if you test HIV positive, it's that chance to get onto treatment, which will ensure, one, you can't pass the virus on to your sexual partners, and two, you can live a normal, healthy life knowing that you're taking control by getting that virus undetectable. And I think the key thing to mention is that sexual health is a really important priority for everybody. It's a particular priority for our LGBTQ+ populations because some of them may be at particular risk of sexually transmitted infections, including HIV. And that opportunity to talk, to educate yourself, to educate each other is such an important part of staying healthy in general.
Yeah, you're so right. You mentioned PrEP as being one of the ways in which we can prevent HIV. What other ways can we prevent actually contracting HIV in the first place?
So I think one of the most important things is for people who are living with HIV to be on effective treatment. That undetectable is untransmittable, or U=U message, has really gained traction over recent years. And for the first time in 2023, the World Health Organization also came on board and actually committed to that word zero. And zero is such an empowering concept. It's so important for people who experience stigma, including self-stigma, to know that they are zero risk. So by getting people with HIV undetectable on treatment, that's a really important way of preventing onward transmission. Of course, that requires testing. PrEP, you mentioned, and it's a very, very highly effective method of prevention. But of course, there are other things. We still recommend using condoms. PrEP will only protect you against acquiring HIV. It won't protect you from other infections. Condoms aren't 100% for every infection, but they do dramatically reduce the risk of many, and that includes things like chlamydia and gonorrhea. So regular testing, not just a view of your partners. Prompt treatment. If you are diagnosed with an infection, then it's about contacting your partners so that they can get tested and treated if necessary. Condoms, PrEP, and being on antiretroviral therapy if you are living with HIV.
Yes, yeah, that's incredible news about the WHO finally recognizing that zero word. I know myself when I was diagnosed with HIV in 2018. Already U=U was a message that was out there. Unfortunately, quite new news. But the fact that I could have these conversations with people saying that there was zero risk of me transmitting HIV was so empowering, and it was like a real game changer. And I'm so grateful I didn't have to have the previous sorts of discussions that people have to.
So it is such an empowering message, and it's really motivating. Some people really struggle to take their pills, but knowing that taking taking their pills protects their sexual partners is that added impetus they sometimes need.
Okay, so Laura, imagine this. I've done my sexual health screening and it comes back with a positive HIV result. What do I do?
So firstly, whenever you've had a reactive HIV result, we have to confirm that. That's why we tend to use that word reactive, and we don't say it's a positive result until it's confirmed. Assuming it's been confirmed and you'll be seen in an HIV clinic very, very quickly, we'd have a discussion and we would talk about when you want to start treatment, what you might want to start, and what living with HIV is going to mean for you. Now, we by and large start treatment immediately. Whether that means on the same day as your confirmed diagnosis, if you want to do that, that's fine. Waiting for a couple of weeks isn't going to cause any harm at all. The key thing is nowadays we don't wait. We used to wait for people's CD4 counts, that test that tells us how healthy their immune system is. We used to wait for the CD4 count to drop, and now we've got good evidence that it's good for the population, it's good for individual people to start treatment as soon as they are ready to do so.
Now the medication is so incredible that it's such a no-brainer, really.
Things are much better tolerated, much less toxic, and it's easier to start treatment sooner on that basis. Single pill. We've also got injectables available. Now, at the moment, that's only for people who've been undetectable on treatment for a while, and there are sort of certain caveats and reasons why we can't use injectables, but if people want that, that's an option for many.
As more people are living older, with HIV, because it's thankfully not killing us off anymore, we're going to have now coming into issues involved around aging. So that leads me into my next question. What do you think the primary issues are impacting older LGBTQ plus people, including those living with HIV?
Oh, it's such an important thing. I think firstly, we need to think about the general issues related to aging. Let's start with the medical ones, because that's where my particular expertise lies, is medicine. But we know as you get older, you get age-related conditions, blood pressure issues, heart disease. No, I know, Daisy. Whereas I, unfortunately, am starting to enter that territory. I know it's hard to believe. But the issues related to kidney disease, heart disease, bone disease, lung disease, all the things that start to happen as we get older, of course, affecting this population. We also know that mental health issues can become more prevalent as people get older. Social isolation and loneliness can particularly impact people, particularly if they're living in communities that aren't very welcoming or accepting of their gender or sexuality, for example. If we then think about people with HIV, then there's the additive effect of not only are you taking tablets for other conditions, you're also having to take tablets for your HIV. There's a risk sometimes that those medications can interact with each other. And it can be really challenging to navigate all of that. For anybody to navigate care from different specialists across the healthcare system can be a challenge. And when you add HIV in as well, that's an additional concern. It's an additional challenge for people as they try and navigate their increasingly complex health as they get older.
And I suppose you've got this real double whammy, don't you, for older people living with HIV, because you've got already issues of loneliness and isolation and, you know, not having a community or a family around you as you get older.
This is where I think HIV community support is so critical, because you're right, you know, many people, society's changed, many people don't have those family structures in place, you know, regardless of whether they live with HIV or not. But I think it's about creating our own communities. I think more and more in society people rely on friends, perhaps where they used to rely on family members. But for people living with HIV, the incredible community organisations that are out there to be that family, to be that support, to be that space where they can share their status and know that they won't be judged, I think is a really, really important element.
We will put a list of resources down below this interview as well, if you want to check out some of those incredible organisations as well. So I've been dropped this rather raunchy sounding word, and I'd like you to tell me what it means. Polypharmacy.
I know. Actually, wouldn't polypharmacy be a good drug name, Daisy? Hi, I'm polypharmacy.
She dresses as a nurse all the time?
Yeah, or just a dress all laden with pills and
Handing
syringes and
out shots to the audience.
yeah, fiber gel sachets and things like that.
Is it too
Where
late for me to rebrand?
no, you're too famous as you
Oh,
are,
that's
unfortunately.
true. I am in my own
It's not
lunchbox.
it's not too late for me. So polypharmacy is it is an exciting sounding word, but poly means many, pharmacy means medication. So it means taking lots of medications. So as I've touched on, if you have other conditions, you need to be taking meds for those conditions as well as meds for your HIV. And that's where the issue is about navigating, taking different pills, what might interact with something else. It's why it's really important, and we really, really encourage everyone living with HIV to share their HIV diagnosis and their medication with their other healthcare professionals. By and large, most people do, but there are still people who fear confidentiality concerns, may have had a negative experience in the past. And what I'd say to them is, please try again.
Now, coming back to our dear older queer folk, can you tell me what comorbidities means,
Yeah.
and what does that include?
Yeah. So again, co means alongside, morbidities means illnesses. So comorbidities is a term we use to refer to other conditions that someone with HIV or without HIV may be living with. These are just, and unfortunately, as we get older, it often isn't just one thing, it's often more than one.
What sort of underexplored issues or indeed risks do you think face older LGBTQ people as we age?
Oh goodness, I think in general there's good information, and if you can get an appointment, good access to sort of testing and treatment. What I think's missing most is a focus on sexual pleasure and sexual well-being. I think although we talk about sexual health services, the funding and challenges with workforce and all of that miserable stuff means that naturally you focus on ill health, you focus on testing people with symptoms, you focus on treating conditions, you focus on preventing infections, whereas a much more holistic approach to supporting people to enjoy sex.
One thing that I will mention about the HIV positive community is they are a bunch of horny. They are always talking about how much they love sex and how much sex they have. And it's incredible. And actually, it's that, going into a space where people are really open about their status and also talking about how empowering that is and, how they're making the most of it. I just think it's incredible. So I hope that a lot of other people who are watching this go out and engage in some of those communities, even just for a little bit of here's some raunchy. So speaking of raunchy stories, if say somebody's older, maybe they've come out of a long-term relationship, maybe they've lost a partner, maybe their traditional relationship is opening its doors to third, fourth, fifth people, what kind of dating advice would you give them?
Oh my word, you're asking a middle-aged married woman from Hertfordshire,
You're the love doctor now, Laura.
polyamorous. So I think that the first thing would be get yourself tested. You even if you've only had sex with one person for the last 20 years, you don't know what they've been doing. So get yourself tested, go down to a sexual health clinic, find out, have you had the right vaccinations? You might have thought you had a vaccine for something many years ago. Is that up to date? Just go and get that checkup and have a chat and make yourself aware. And I think the other really important thing is consent, about making sure that you're comfortable with whatever you're doing. You can do whatever you like as long as that's your choice, you are informed and you are safe. So I think it's about equipping yourself with the right information, getting that baseline screen done, asking your partners if they've had a checkup, because knowing that you have tested for STIs isn't an uncool thing to do, it's the coolest thing you can do. Know your HIV status, test regularly for other STIs, expect the same of your sexual partners, because if you keep yourself healthy, then you help keep other people healthy as well.
So communication is key and consent is sexy.
Absolutely.
I like your thinking. So we're kind of getting to the end of it now. We've kept these good people long enough, I think. But is there anything else that you think is super important in terms of stopping HIV and actively aging?
So stopping HIV, we've got the tools to reach zero, and the goal is to reach zero new HIV transmissions by 2030, but it's about access at a kind of structural level, but also an individual level, getting tested, using the appropriate prevention tools that are suitable for you, and if you're living with HIV, making sure that you are able to get and stay undetectable. And that's about finding not just the right medication, but the right clinic and the right environment for you. With regards to healthy aging, again, being on HIV treatment if you're living with HIV is an important part of that, but it's about equipping yourself with information. It's about healthy lifestyle. It's all the boring things, Daisy. It's the stopping smoking if you smoke. It's about drinking alcohol within reasonable limits. It's about exercise. It's about health. And I know it's boring.
You're killing me.
I know I am, and I'm ending on a really dull note, but you do those simple things and you will live a longer, healthier, and happier life. So incorporate those things into your day-to-day life. Take your treatment, get tested, test regularly, get your partners to test regularly, and all of those different ingredients will add up to a recipe for a happy and healthy older life.
Okay, so thank you everybody for joining us today on this HIV active aging discussion with the incredible Dr. 𝗚𝗏𝗏𝗏. I knew you'd be a big fan of her. For any healthcare providers watching, I want to let you know that 𝗵𝗂𝗍𝗵𝘁𝗍 are offering free CME or CE seminars on HIV and active aging. So if you're interested, please visit aging.𝗵𝗂𝗍𝗵𝘁.com for more information. And speaking of more information, Dr. Laura Waters, how do you feel about sticking around with me now and taking some live questions from our incredible audience?
Well, I think that sounds like a perfect way to spend the next half hour or so before I pour myself a Campari, Daisy. I'd be delighted.
Ooh, I'll join you in that one as well. So let's hand over to the audience. The first question from our audience is, there's an implication people can go straight to a sexual health clinic. Is this because GPs are not equipped to deal with HIV status and subsequent treatments? What do you think, Laura?
So, well, I think I'll break it down so there's a sexual health clinic attendance to be tested and, if necessary, treated, and if necessary, given advice about prevention of sexually transmitted infections. And GPs can do a fair bit of that as well. So you should be able to get sexual health screening at your GP. The thing is, you'll get a broader range of options at a sexual health service. So for example, if you're HIV negative but at risk of HIV and you want PrEP, that's something that at the moment is only available in sexual health services. Now, hopefully that's going to evolve, because we know that a lot of people who need PrEP don't come to sexual health services. Then the second thing is around, and I think that's what this question's alluding to, is HIV care and treatment. And again, at the moment, only HIV clinics can prescribe HIV medication. And you can self-refer, because at the moment in England, you can get your care in any clinic that you want to. So if you prefer to get your HIV care where you work, or you don't want to get your care in your local community because you're concerned that there might be people you know working in the clinic, you can get your care wherever you like. However, we really try to work with GPs, and we really encourage people to share their HIV diagnosis with their GPs so they can help us provide the best care. And moving forwards, we may well, for people who want to, be working much more closely with GPs and pharmacists based in GP practices, so that we can all work together. Because if you're seeing your GP regularly for something else, there's no good reason really why they couldn't be providing at least part of your HIV care. So at the moment, kind of stacked against GPs because having to prescribe drugs and specialist services, but a lot of work to try and work better together.
Yeah, my clinic sends a letter to my GP after each of my appointments with my latest viral loads and CD4 counts when they come around. So it's quite good, because then when you go to see the doctor, they know that this is another condition that
Yep.
that might impact what's happening.
Absolutely. I'll tell you what's changed is in the earlier days, I started working in HIV in 2002, and a lot of people didn't want their GPs to know, and sometimes people would get upset if their GPs were informed. But now that's flipped. That's still an issue for some people, and we will work with that. But more common now, someone will come in and go, "What do you mean you can't see my cholesterol results from my GP? They did them last week. What do you mean you can't see the letter from my bone specialist?" And people, because they are increasingly using apps and all this combined technology, and actually, most people, I would say, would prefer to have more joined up care, not less.
Agreed. We want to treat people holistically, don't we? Not just all of these separate conditions. Another question from our gorgeous audience is, if one has an existing condition, for example, diabetes, heart disease, heart issues, strokes, weight problems, or even more than one of these, is there an age at which it is too late to make changes? And where should they start?
It is never too late. It's never too late. And that's not just a cliche. There's good evidence. So, for example, people with really advanced lung disease, conditions like emphysema, which can be really debilitating. People can be very breathless. Even at that late stage, stopping smoking improves quality of life and improves health. And the same is true for everything listed here, because optimizing your lifestyle, taking the treatments that are recommended, will yield so many benefits, not just physical, the psychological as well. We talk about exercise a lot as a way to reduce the risk of heart disease and joint problems, etc., etc. But exercise is also hugely beneficial for our psychological health. It has so many other benefits. So it's never too late. And where do you start? I think you start with, you can talk to your HIV clinic, you can talk to peer support organisations. I think peer support organisations have shifted in the same way that HIV doctors have. I talk much more about preventing heart disease than I used to 10, 15 years ago, and thankfully less and less about HIV drug side effects. So peer support organisations have done the same. Our health advisors, which is our team that deals with newly diagnosed people and advice and contact tracing for people with other infections, they now increasingly talk about diet and alcohol and exercise. So I think whoever you feel comfortable to talk to, GPs, of course, this is their bread and butter. But I know it sounds a bit boring. The NHS website is actually really, really good. Really good information about diet and exercise. So I think just starting with making a decision to change something. And I think the one thing, if we could do anything, would be, if you still smoke, is to stop smoking. That's probably the single most important thing. But really, I think addressing all those different things and just making that effort to make some changes in your life. And the one thing I say to people is, don't look back a week or a month and you'll think, I haven't lost any weight, I don't feel any better. Look back over longer periods of time. It's like watching a plant grow. If you watch that plant every day, it doesn't seem to make much progress. But if you look at that plant 6 months later, you can see just how much you've achieved.
Now, this one is very interesting. A question regarding mental health. What mental health resources are available for older LGBTQ individuals facing issues like depression, anxiety, social isolation, and stigma? And I guess maybe this is is this my turn?
I think so. I think so.
She knows a little bit about mental health. Well, we know that half of LGBTQ people report having experienced depression. So we know that this community is disproportionately affected. And so mental health is super important, even more so as we age, given that we are such a youth-obsessed group of people. I actually think that the LGBTQ Foundation, where you all are an incredible resource for you. They offer talking therapies, peer support, and a helpline as well for queer people if you're not actually able to come and see them in the office there. So they are excellent ambassadors for older LGBTQ people. In London, there is a group called 𝗵𝗂𝗶𝘀𝗆 who offer a sliding scale of counselling and talking therapies as well. I have used them myself. They do also do remote services. And also LGBT Health and Age UK. Both have sections, quite extensive sections on their websites about issues dedicated to issues faced by older members of our community. But yeah, there's really unique things that we start to face as we age in the queer community. And so hopefully those groups will be able to help you out a little bit. Okay. Another question from our gorgeous audience, which I think is directed to my darling colleague. It says, is there a way to overcome barriers from sexual health clinic medical info to GP so people don't have to keep repeating themselves in regards to that they are already on HIV medication and it conflicting with other medications? So I think this is kind of following on from our previous question about this kind of segmented treatment that people experience within the NHS, particularly, I suppose. And is there any way to streamline that? Can the individual do anything to help streamline that?
Yeah, and it does. It very much follows on, and it's a difficult question to answer because it varies from one clinic to the next. Because increasingly, HIV clinics are using electronic health records that are compatible or even shared with the broader healthcare system, and some aren't. So I think if it's about improving communication and not having to repeat yourself, firstly, it's about making sure your clinic does write to your GP regularly. They should make sure that the permission is up to date, it's the correct practice, and that you have you consent to them contacting. It's about making sure, using your NHS app, you can have your HIV condition and your HIV medication on your NHS app if you choose to, and then it's up to date. But I think if you're happy to, making yourself that centre point of care, you're the person with the information, you're the person with the agency to decide who knows what, and you can help educate both your GP and your HIV clinic about how you want things to be done.
Yes, and I think that this community has been champions of self-advocacy over the years, haven't they? So many of the changes and the progress that we are so grateful for today have really come from within the community, self-advocating and pushing back for those sorts of changes. So keep up the good fight, everybody. I believe in you. And another question regarding community. It says, can you suggest any support services or community resources that can help older LGBTQ individuals with social connections and healthcare advocacy? So again, I would call back to those amazing peer mentor-based organisation. Mind Out has a 50+ project based in both London and Manchester, which aims to respond to the support needs of people over 50. And they do a lot of sort of social programs and things as well to get people together and to meet each other. So I think that's a really great thing to check out. The LGBT Foundation, again, has an array of incredible support services as well. They do also have services around sexual health and domestic abuse, which, of course, if you're experiencing anything like that, it's really important to reach out and get help for that. And there's people who can help you with those sorts of things. And then Positively UK is another UK-based, they're London-based, but they do offer a lot of online activities and programs, including things like yoga that you can join in, and they're all free and they are available to check out on their website. They have different social groups catering for different demographics as well. So I would really recommend checking out them as well if you want to. So I think this is a really great question. This is something that's quite new and a lot of people are quite curious about it. And this audience member would like some more information about Doxy-PEP and Doxy-PrEP and when can they have it. They are eager for Doxy. What does it mean? What is Doxy-PEP's PrEP?
Yeah. So I'm going to focus on Doxy-PEP because that's where by far the most of the evidence and the studies have been. So Doxy-PEP means taking a very widely prescribed cheap antibiotic called doxycycline after sex to reduce the risk of sexually transmitted infections. And what you see is reductions in chlamydia, reductions in syphilis, and also, although less of a degree because much of it's resistant, you do see in some studies a reduction in gonorrhea as well. So by taking antibiotics after sex, you can reduce your risk of sexually transmitted infections. And it works. Now, the studies so far have been unsuccessful in women. So where the results have shown it's effective have been in gay and bisexual and other men who have sex with men. Lots of debate about why. And we know that HIV PrEP doesn't do so well in women when it's tablets. And various reasons, women just aren't taking these tablets. There's a lot of work to be done. But let's focus where it does work. Why is it not available? It will be. There's still, the difficulty is there's been a lot of pardon the pun, resistance because of concerns about drug resistance. So, there's this whole, and it's important, antimicrobial stewardship. There's an awful lot of overuse of antibiotics, not just in humans, in the farming industry and veterinary industry as well. And there's lots of examples where we use antibiotics where we probably don't need to. So there's a bit of a sense that people are applying a value judgment here as well. And one of the reasons everyone's been a bit, reluctant to use it is because this is about sex. And we know from the story of PrEP and access to HIV prevention that sometimes that's the case. Having said that old chestnut. Having said that, this has all emerged at a time when everyone is very focused on the harms of antimicrobial, of antibiotic resistance, because it's a real looming fear in everyone's mind that one day we'll get a super bug that just isn't treatable. But at the moment, based on the evidence we have, the benefits outweigh the risk, and actually, by using antibiotics to prevent sexually transmitted infections, there'll be less sexually transmitted infections to treat, and the overall effect might be less antibiotic use because people will have. So these are all things. So basically, it needs to be rolled out. Some clinics, if they haven't started already, are starting imminently. So I know at Mortimer Market Centre I'm based, they're planning a pilot very, very soon. I think at Dean Street in London, they may have started already. And the same may be true in clinics like Manchester. Again, there's lots of very proactive teams in these sexual health services. The national guidance from BASH, who are the body who come up with the guidelines, again, it's all in the process of being updated. So I think if it hasn't started in some of these clinics already, we should start seeing updates to the guidelines and updates in practice.
Yes. And I think that's a really interesting point, because anytime I've had conversations with people about Doxy-PEP, usually the argument in return is, oh, what about resistance, and we're using too many antibiotics. I think your point of it being a value judgment is so true, because people wouldn't say this about any other condition that could be quite nasty and potentially preventable. It's just because it's sex, and people just want to stop us having fun and living our life.
Exactly. And one thing to point out is, syphilis can be really serious still. We see people who have permanent damage to their hearing or their eyesight, not commonly, but it happens. And these kind of negative outcomes are preventable.
This is an interesting question from the audience. It says, if my HIV is undetectable, is there any reason to switch my HIV treatment?
That's a good question. And I think it's one of the main reasons people don't switch, because of that old, if it ain't broke, don't fix it kind of belief. And that has its place. But there are often changes either to the treatments available. So there might be things that you don't know about, like injectable treatment or single tablets or 2 drug combinations instead of 3, which as we get older, that kind of sense that maybe being on fewer medications if we can safely might be sensible. And you might have changed. As people get older, bones, kidneys, things change over time. And not only that, as we get older, our bodies can handle the drugs differently. So for some people, medication that wasn't causing side effects like insomnia when they started the drug 15 years ago may start causing issues further down the line. So I think regularly reviewing your medication, asking your clinic, whether that's your nurse, your pharmacist, your doctor, peer support worker, whoever, what are the new treatments available? Are they suitable for me? You might go to a clinic where they do clinical trials, or you might get access to brand new treatments that aren't even licensed yet. So I think there's many reasons related to side effects, long-term health, and your choices that mean being undetectable doesn't necessarily mean you shouldn't think about changing your therapy.
Yeah, it's very interesting. I have a friend who's recently just gone to his clinic and asked to change because he was on 3 pills a day. And I was like,
Yeah.
What are you doing? And so he changed over to 1 pill a day. And I've actually just recently started injectable medication myself.
Fabulous.
Now, this is going to be our final question. We have run out of time, our beautiful, beautiful audience there in Manchester. So our final question is, how can I find LGBTQ-friendly healthcare providers and services? Now, I think that this is a very interesting thing because I think that this idea that perhaps we're not going to be understood by our healthcare provider, or we're not going to be necessarily accepted by them, can hold people back from seeking help that they need. The NHS, which I imagine Dr. Laura Waters knows a little bit about, does in fact have an plan in place that is aiming to ensure that LGBT people's needs are at the heart of the NHS, and that people can be confident that they will receive the best possible care. And on top of that, the LGBT Foundation do have a program called Pride in Practice, and that works to improve the experience of LGBTQ plus people accessing primary health care services. And then on top of that, I'd like to mention Fast Track Cities HIV Confident Charter, because I think this will have a really amazing trickle-down effect into all of our healthcare services. So the Fast Track Cities initiative is rolling out an educational program of which I am an ambassador, and it is aimed at updating the knowledge, particularly around HIV, for people working in large organisations and also in healthcare settings, because a lot of people do experience stigmatised behaviour when they're accessing their primary care. Yeah. So rest assured, there are a lot of very clever and very important people, other than myself, working behind the scenes to make sure that primary healthcare services, and all services actually, are more HIV friendly and indeed more queer friendly as well. So, I hate to say it, but we've come to the end of this incredible evening. Thank you everybody there at the LGBT Foundation in Manchester. I hope you have enjoyed this. I hope you've learned something. I hope you've had a giggle. And so I'd like to thank the team there at the LGBT Foundation for tonight and for the amazing work that you do for the community. I'd like to thank 𝗵𝗂𝗄𝗏 for making this evening possible, for bringing these gorgeous visages onto your screen. And of course, I couldn't go anywhere without thanking our very own Doctor of Love, the fabulous Laura Waters, aka the scene's newest drag queen, Polypharmacy. We might see her in her pink striped pajamas on a stage soon. Do wish that we could spend more time with you and enjoy a chinwag, but as they say, it's been swell, but the swelling has gone down, and we are going to leave you in peace to enjoy the rest of your evening. I have been your intrepid reporter and host, Miss Daisy Puller, your favourite bogan bombshell. So please enjoy the rest of your night, and as always, take care of yourself and of others. Good night.
Thank you. Good night.